The American system of mass incarceration is plagued by a serious and pervasive problem with mental health. In the United States, as well as elsewhere in the world, incarcerated people have higher rates of mental health illness than the general population. A Bureau of Justice Statistics concentrates on findings in 2006 that over a portion of the prisoners detained in the U.S. state remedial offices revealed a psychological well-being condition. Of these, roughly 33% revealed significant sadness or craziness, 12% detailed dreams, and 8% announced mental trips. As a result, a significant number of inmates not only report having poor mental health, but also serious mental health conditions. Anyone you know in prison might be suffering from a mental health disorder. Inmates from around the world need help getting treatment for current or past mental illnesses. Today I'd like to talk to you first about the reasons why mental health is so high in a prison system, second, about ways to help inmates already in prison with mental illnesses, and lastly, how helping can make a difference. I'll start by discussing the reasons for mental health in prison. Mental health is much higher in the prison system than in the regular community. The problem is that no one seems to see or care about the well-being of a person in prison as they continue to suffer with the disorder. For people who have a mental health disorder and get arrested, the effects of just being incarcerated will be damaging enough to their mental stability. The jail climates can be innately harming to emotional wellness because of the ensuing separation from family, society, and social help, loss of independence, lessened significance and reason for life, apprehension about exploitation, expanded fatigue, the capriciousness of environmental elements, congestion, and corrective nature, encountering and seeing brutality, pessimistic staff, detainee cooperation, and other aversive encounters. Jamichael Mitchell, 24, had not been taking his schizophrenia medication when he was arrested for stealing a bottle of Mountain Dew, a Snickers bar, and a zebra cake from 7-Eleven. After waiting more than a month in jail, he was found to be incompetent to stand trial due to mental illnesses and ordered to go to a state hospital for competency restoration, a combination of psychiatric medication, mental health treatment, and education about the legal process. But no beds were available, and Mitchell's condition deteriorated as weeks turned into months when he waited in jail. He refused to eat and take his medications. 4 months after his arrest, Mitchell was found dead in his cell, covered in urine and fecal material. He had died of cardiac arrhythmia related to wasting syndrome, a disorder characterized by extreme weight loss. Tragedies happen when mental health isn't taken seriously. Not only is this a problem nationally, but it's a big problem in the state of California, Illinois, and New York. In the U.S. correction systems, serious mental illnesses have become so common that jails and prisons are now commonly referred to as the new asylums. There are currently more mentally ill inmates in the Los Angeles County Jail, Cook County Jail in Chicago, and Rikers Island Jail in New York than any other psychiatric hospital in the United States of America. It is now believed that a serious mental illness affects approximately 20% of inmates in jail, 15% of inmates in state prisons. This indicates that approximately 383,000 individuals with severe psychiatric illnesses were in prison in the United States in 2014, nearly 10 times the number of patients remaining in the country's state hospitals, based on a total population of inmates. The ones who are affected the most are the inmates who struggle with a disorder. The American Psychological Association says that 64% of people who are in jail, 54% of people who are in state prison, and 45% of people who are in the federal prisons have mental health issues. Additionally, substance abuse is prevalent among inmates. Now I'll discuss ways to help improve the mental health of inmates. There are some ways that we can help inmates in prison who have mental health issues. Enact the Mentally Ill Offender Treatment and Crime Reduction Act. Reduce the rate of incarcerated persons with mental illnesses. Improve access to public benefits covering all mental health services, ensuring sufficient specialized facilities for seriously mentally ill prisoners. Inmates will get the help they need to make imprisonment not sufferable. If solutions like these never happen, then inmates won't get better and will continue to suffer. The best course of action for better mental health in prisons is reducing the number of people who already have a mental health disorder in jail, and making specialized facilities for those in jail that need to get the help but they can't. By creating a special building for inmates who have mental health issues, they can go there and get therapy and medication if need be. For those who aren't arrested and are having a mental health crisis, cops should not arrest right away and look to the situation differently to determine what's the best for everyone. I have discussed reasons for why and how to help inmates. Now I will talk about how doing all this can make such a big difference in the world. Helping those with a mental illness in the prison system will create fewer tragedies happening inside and outside, and provide a better environment for everyone. Better chances of fewer fights in prison, fewer people with mental illnesses being locked up for the wrong reasons, and the environment in prison will be less depressing. Not helping those who suffer from mental illnesses will continue to suffer, and worse, things will happen to them, whether it's to themselves or others around them. As you can see, helping prisoners with mental issues will benefit them and others around them. I've told you about the reasons why it's so hard for those people with mental illnesses to be in prison, and ways you can help them get the treatment they need. What if you knew someone with a mental illness and they were just arrested for no reason for having an episode? It would be insufferable for them to be locked up with no help whatsoever. Creating a plan to help inmates in the need of treatment will make their sentence more smooth and less frustrating. Everyone deserves the help they need and treatment, regardless of whether they are in prison or not. By creating better mental health spaces in prison, we are therefore creating better people for society, and therefore lowering the rate that people will likely return to prison, and therefore making the world a safer place.